mentioned a couple of things, Dr. Shah, but when you see a cancer patient or, when you talk to a cancer patient, what are three things that they should do as far as changes in their diet for optimal cancer outcomes today and in the future?
That's a great question. So a few things that I would say, just general overall health and well-being practices that any patient could try to adopt and make small gradual changes. One of the main things is that I think fiber is your friend. I think in oncology and in generally, we are all obsessed with protein and forget about fiber. Fiber is one of the very important nutrients in our diet that should be there, because it's what feeds your microbiome, and we are more microbiome than human cells if you think about like how much of us are microbiome. And so I would say aim to get 80 to 90% of calories from unprocessed plant foods, and less than 5% of the US population meet the fiber requirements. So starting small and increasing gradually the fiber in your food by swapping out some food groups could be one way. Another thing is also there is no single supplement or food that is going to cure cancer, but having a diversity of your gut microbiome is another thing that's quite important. And studies have shown that ways to improve diversity of the gut microbiome is to aim to eat a wide variety of plant-based foods. So 30 different types of plant-based foods in a week improve gut microbiome diversity. And when I'm talking about 30 different plant foods, I don't mean 30 times eating the same plant food like broccoli or beans, but eating 30 different fruits, vegetables, nuts, seeds, and whole grains in a week. And I think this is easily achievable, but for some people, it doesn't come come as a second nature, but it's something to think about in terms of what you're eating. Herbs, spices, all of that count in the 30 different plant foods. And then the third thing I would say is that choosing plant-based sources of protein over animal-based sources is a good way to get protein and fiber simultaneously. So beans, nuts, seeds, tofu, whenever possible, to swap that out is another good healthy tip.
Makes sense. So you mentioned increasing the amount of fiber in your diet, increasing the amount of plant-based foods, and not only the number, but also the diversity of plant-based foods that can help patients with cancer.
So to summarize, the 3 points I said was, one is increasing fiber in your diet, which could be through unprocessed plant food intake. 2 would be increasing diversity of your gut microbiome, and that would come through eating a variety of plant-based foods, not just the same one. And 3 is prioritizing plant over animal protein sources for getting more fiber and protein simultaneously, but also other properties like, flavonoids and things that come with it.